I was on the radio this morning on Shannonside FM, which is Longford, Leitrim and Roscommon, talking about the connection between male pattern hair loss and erectile dysfunction. So there are many ways in which male pattern hair loss and erectile dysfunction kind of intersect, but I just want to talk about one of them today, okay? And the one I want to talk about today is medication. So just very briefly, what causes male pattern hair loss is an enzyme called 5-alpha reductase type 2. That enzyme is responsible for converting testosterone to its more potent form, DHT. And men who have follicular sensitivity to DHT will experience a follicular miniaturization. When those follicles shrink, their hair begins to shed. And that's the very normal cycle that we see in male pattern hair loss, okay? Usually if you go to a doctor, they will prescribe a product called Propecia that is very effective, by the way, at treating male pattern hair loss. Very, very effective. However, that product contains finasteride, that's the active ingredient. Finasteride originally was prescribed for reducing the size of enlarged prostate, and it works very well. It's marketed as a medication called Proscar. Like I said, it does a great job for working on enlarged prostate. However, in order to reduce the size of a prostate, we must reduce testosterone and DHT, and that can have devastating side effects for men. Anywhere between 5 and 15% of men will experience low libido, difficulty getting and maintaining an erection, depression, low mood, even suicidal thoughts. It can have very serious side effects. We often expect that those side effects will go away when the man ceases that medication, but quite often a man can suffer from something called PFS, that's post-finasteride syndrome, where those side effects continue for months or even years after he has reduced or stopped using that medication altogether. So what I would say is, if you are suffering from male pattern hair loss, there are lots of natural treatments that you can do that are terribly effective and clinically proven. They work really well. You don't need to go down the medication route and risk your sexual and mental health, okay? If you have any more questions about anything I just said, you can DM me in confidence or you can give me a call on 062 888002. See you later.